Hi, and you're welcome to today's episode on Health Awareness Matters. That is Health Matters right here on Aneke TV. So across Nigeria and other parts of the world, cholera remains one of the most persistent threats to public health. It's fast, it's dangerous, but then it's also very preventable. Now, what cholera really is, why it spreads so quickly, and most importantly, how you and your loved ones can stay safe. Now, with us in the studio today is Dr. Taiwo Kolawole, and he is the director CAT Medical Services right here in Enugu State. Is a public health specialist who has first-hand experience with community health campaigns. And we'll also be hearing from you, our viewers, through your comments across all our social media platforms on Facebook, X, Instagram, TikTok, and right here on YouTube, all at Aneke TV. So stay tuned. This is a conversation that could save lives. So moving on, let's meet our guest today. Good morning, good afternoon. Good afternoon, doctor. It's good to have you on the show. It's today we are talking about cholera. You know, cholera has become should I call it a plague, or should I call it a pandemic? But then, what exactly is cholera, and how does it affect people?
Excuse me, please. It's a bacterial infection that affects human beings, transmitted in different forms. Maybe, let me just say, through poor hygiene.
Okay.
You can get it through food. You can get it through water. You can get it through the environment. So there are different ways that you can get cholera.
Okay. So can you help us understand how and why cholera spreads so rapidly, especially in crowded or under-resourced areas?
You know, it's transmitted through food and water. Especially in this part of the country, or do I say this part of the world, where our hygiene situation is not too good.
Okay.
For people who are infected when they defecate in open places. It's like Africans just have this this culture of you want to pee, you want to defecate, just look for the nearest bush or the nearest hidden place. Even when we see a toilet here, we're not ready to enter that toilet. We want to urinate in the bush.
They will tell you the breeze is
or in the
passing.
gutter. And when you do that, you excrete those bacteria.
Okay.
And it's on the floor, it's on the grass. Children go there and play. They play football. The ball is there. It rubs on the ball. They carry the ball. It rubs on their body. And while they are playing, they are licking their finger. Or they just get apple, orange, and they are sucking. They're already taking it in. And then when we have, overcrowded places like Obiagu, Abapa, when you come to some of those places, you see the sewage system.
Okay.
It's not too organized and it's exposed. You see a gutter here, a woman is selling pawpaw. The pawpaw she has cut and she's displaying on a tray. You understand? And while she's cutting, the knife falls down. She peels the knife. Even some of them without washing, she begins to cut again. So that's why it makes it easy for the thing to spread.
Okay. So let's shift to solutions, because cholera we know is very preventable. We know. So what practical steps can people take at home and in their communities to stop cholera before it starts?
Before it starts. We've always agreed that prevention is better than cure. So what we have to do is to adopt proper hygiene. Before you eat, you want to wash your hand. Make sure you wash your hand with soap and water before you eat. You've gone to toilet and you are coming out, wash your hand. Even if you are not living in flats, most of us have booters in front of our doors. Make sure that you get clean water, cover your booter, so that, and then you have a permanent dispenser there. So that when you come out from toilet, you can either open the tap or somebody helps you to get water. Wash your hand with soap and water before you enter or before you eat. Because if you got it from the toilet, you know, most times we have public toilets. If you can get it from the toilet. Somebody who has it, when he touches the handle of the toilet, in opening the toilet, he has transmitted it. And you are coming, you are opening the same door, you have gotten it.
Okay.
So when you come and you wash your hand, you are washing it off.
Okay.
That is one. Then secondly, the way we prepare our food is also very important. We should not expose our food. Our cutleries should be well kept and washed before we use them, and even after using them. And then, for those who live in public yards, make sure that, you know, sometimes you are cooking, the pot is open, you are not even covering it. You understand? So we have to take those precautions. And then when you talk of water, we suggest that people boil their water. Though by standard, we say drink boiled, chlorinated water. But who has money in Africa? Who will listen to you that he wants to chlorinate water?
You know, some people use this thing they call alum.
Alum.
So I don't know. So I would
No,
like you
what
to tell
alum
us.
does
Okay.
is to separate the dirt, the solutes,
Okay.
from the water.
It doesn't purify.
It doesn't purify water.
Okay.
It doesn't affect the bacteria. So it's better you boil your water before you drink. Boil it. Have a good container where you keep your boiled water before you drink. Then the government also has a major part to play.
Okay.
Government has a major part. Though the government is trying, they are trying, but funding is very important. Because like the federal agency, the Nigerian Disease Control and Prevention Agency, is that they are the primary federal agency lead to take care of this. They are trying. The state governments too are trying. But some of these agencies do not have enough funding to take care of this. To take care of this, especially as it has to do with how do I put it now? Jingles, that's informing the public about this cholera control, what it has to do, because you know it affects the masses mostly. I need to get into the midst of the masses to talk to them at the Federal Ministry of Environment, Federal Ministry of Health, getting the communities together, explaining what cholera is, how dangerous it is, because it can kill within few hours and few days.
Okay. So
yes,
can you walk us through the progression of cholera? Like since you said it kills within hours and few hours and days, can you like walk us through the progression, how it starts, the first stage? Does it have working stages?
Yeah, you see, once you start seeing the symptoms, yes, within a few hours or depending on how strong your immune system is. You see some people vomiting. You know, it's a diarrheal disease. Vomiting and stooling. And once you see somebody vomiting and stooling, that person is losing fluid. And one major component of the human body is fluid. Water is very important. It takes about 90% of the composition of the body. Once you lose water, the cells and other enzymes and chemicals in the body cannot really function as they should function. So when you are losing fluid, the body begins to react. So you see them losing weight, the eyes going in, you see them having cramps, your mouth becomes dry, and before you know it, they can get into the state of shock. You understand? That is why, because you are losing fluid in two ways. And the problem is you are vomiting, you try to drink water, you are still vomiting.
Oh, so at this point, it means it doesn't even let you eat anything
It doesn't even allow you to. But what we say is, no matter the extent of vomit, keep drinking. Keep drinking. Because you will not vomit 100%.
Okay.
Maybe you vomit 90%.
There's this kind of water, this solution.
Yes, ORS.
Okay, that also. So instead of drinking the normal, so is it better you take ORS than taking water?
No, yes, when we
in that
talk of
situation?
taking water, it's not just ordinary water.
Okay.
Better you take ORS, oral rehydration solution. Is sold in the chemists, in pharmacy shops, and you can do it in your home.
Okay.
All you need to do is get a boiled water, put about 6 level teaspoon in it. That should be 1 liter of water. 1 liter of water, Ragolis water. You can use that, and then put about half teaspoon of salt. Shake it very well. You can be taking it. Okay. Now it replaces the water. It also replaces the sugar and the salt you are losing in the body. Okay. So it helps, keeps you at least rehydrated till you're able to get medical attention. And we also sometimes, you can take coconut water. No, coconut water is not ordinary water. It's not ordinary water. It has other nutrients in it. You can take coconut water. You can take what we call rice water. You know, when you are cooking rice, you parboil.
Okay, that very first water you use in washing the rice. Okay.
Not the one you use in washing the rice.
That's after the parboiling part of it now.
You can give it to the person to take.
Really?
Yes. Oh,
wow.
It's fluid, and it has some carbohydrate there, some nutrients there. You can give the person to drink coconut water. You can also give the person a little bit salted vegetable water to drink. Okay. You understand? So those things keep rehydrating the body. So those are some of the things you have to do.
Okay. All right. So talking about some cultural beliefs or myths about cholera, some people have a lot of beliefs about cholera. So what kind of beliefs or misconceptions have you heard about cholera so that we can debunk them now before people will see cholera and call it something else?
It's not just cultural beliefs, it's cultural and religious beliefs.
Okay.
When people start vomiting and stooling, you can say, well, maybe it's an attack. Christians may say it's an attack.
Okay, village people.
Juju people can say they did the enchantment and the demon has caught the person. Some people can say that he has taken abomination culturally. Right. He has done something abominable. In as much as we are not saying it may not be possible, all we are saying is that if you see somebody vomiting and stealing, at least you have to stop it first. Even if it's attack, even if it's demon, Satan, or whatever it may be, try and stop it first physically. Okay. First aid is important. Get the person to the hospital. And I'm sure they'll be able to stop it.
Okay. In cholera, it mostly affects women and children. Because in most of the cases we've heard, it's majorly the women and the children. Now, how can they be protected from cholera?
It affects all.
Yeah.
But since you said
mostly, statistically, it affects most women and children.
Children and women are more involved in food and water. You understand? It's the woman that does the cooking.
Okay.
It's the children that do the playing around, that the people who roll on the floor, that the people who crawl, that the people who get it. And a woman cannot watch the baby vomiting and stooling and stay away. She will carry her baby. Even if you tell her this baby has infection, she will tell you, leave it, it's my baby. She will carry the baby. And as she's carrying the baby and the baby is vomiting on her, and she's cleaning, some women, before you know it, she has used her mouth to even suck say something is blocking the nose, let me suck, she's sucking it. So that is why it's easy for women and children to get it. So, but when the mothers are well informed, and you see your child vomiting and stooling, the next thing you do is to try and look for a glove. You want to get a glove to wear. You can send someone to get you a glove. You want to get a cloth that will not be will not be able to transmit it. If you have this raincoat, you can quickly put on your raincoat, put on your glove, carry your baby. You know raincoat is made of nylon. Carry your baby, clean up the baby, do what you have to do. Make sure you don't put that hand in your mouth. Take care of your baby. You can remove the glove. You can remove the raincoat.
In that emergency period, are you sure she remember there's something called raincoat and gloves?
Training sometimes help.
Okay.
You know, awareness is important. You know, when you are aware of it, you know you can get it. So you want to protect yourself first.
We'll come back to discuss
or
that.
else, both of you become casualty.
Okay.
And both of you can be lost. So in a bid to save the child, for you to save that child, you must be healthy.
Definitely.
You understand? But if the situation is too emergency and you cannot do that, okay, take care of the baby, but make sure that having done that, you are not put your hand in your mouth. And when you are through, go in, remove all the clothes.
Okay.
Don't drop them in your room. Drop them in a bowl on their own. Take your shower, bath yourself, get the toilet, get disinfectant, bath, change your clothes, change everything. Then that cloth you have used, find a way to properly wash and disinfect it.
All right. Okay. Thank you so much. This is Health Matters on Aneke TV. I am Amaka Nijan. With me in the studio is Dr. Taiwo Kolawole, who is the Director of CATS Medical Services, Enugu. And we are discussing cholera, its preventive measures, and we're trying to create awareness for cholera outbreak in Nigeria. So we're going to show commercial break now, and when we return, we'll be talking about the preventive measures and find out ways we can actually curb the menace of cholera spreading across the nation. Do not go anywhere.
Aqua, water. Water is life. Ancient, sacred, pure. It remembers creation and carries cleansing. It can be calm or it can rage, but it always moves. Aqua teaches us to be soft yet strong, to adapt yet remain, to flow around obstacles yet shape even the hardest stone. We came from water. We need water. And sometimes, when words fail and hearts break, only water falling from our eyes or washing over our skin can heal what language cannot.
Okay, you're welcome back. Still Health Matters on Aneke TV with Amaka Niji, and with me is Doctor. I've increased your rank already.
Okay.
And with me is Dr. Taiwo Kolawole, who is the Director of CATS Medical Services, Enugu, and we're talking about cholera. So, Doctor, before we end up the show today, I would like to discuss the preventive measures. I know initially you've talked about something like that, but we need it in details because there are people who really do not understand what cholera is. They just, because I've seen cases where people just see water anywhere and they drink. You see people even drinking from the same cup and plate with their pets. So and when it comes to the community, how can community leaders, church leaders, how can these people create awareness and tell people that cholera is real and these are ways to prevent it?
It's okay. Community leaders, religious leaders, youth leaders of communities have a great role to play. Even schools, school proprietors have a great role to play. There's this popular balance in Africa that dirty no they kill African man. We believe that dirty no they kill us. Anything that happened, and then some religious beliefs, they will tell you whatever happens is from God. There are some religions that will tell you that whatever happens, it is God that has allowed it.
Okay.
You understand? But we need to know that sometimes it happens not because God wants it to happen, but because we are careless. So let's get to the communities. Let me go to the government first. Government has a major role to play because to mobilize the community, it must start from the government. They need to invite the traditional rulers. Talk to them about it. You cannot underemphasize the importance of the traditional rulers because each community have where they call village squares. where they gather, where they discuss. Like the just concluded month, August. In the East here, we have August meeting,
Yes.
where all the women gather. And when you go to different communities, you see the women discussing so many things. They discuss water supply, they discuss so many things, commercial activities and other things. And those are ways you can get them. So if government, mobilize the community leaders and give it to them as part of the thing they should do. We are giving you this to do, train them, explain to them, then maybe give them an health officer, each community and health officer, and say, organize this in your community. It may not be at the same time. It could be like 10, 15 communities at a time. After that, we move it to 10, 15 communities. Organize these community gatherings, talk to the people there, talk to the youth there. The message will be spreading. Then when you're talking of schools, it's children learn so much. Children believe that teacher are more than their parents. If your child comes and you say, no, hit this, you say, no, my teacher told me this is how I should hit. You understand? They learn so much. So, and we have the Ministry of Education, where they can just bring out the policy and say, okay, so week is cholera campaign week. So all schools talk of cholera to children, tell them how to prevent it, tell them how to avoid it. Teach those teachers. They will pass the message across to the children. And the children will start observing it at all. You understand? Then the churches too. We have CAN, Christian Association of Nigeria. We have CPFN, Christian Pentecostal Fellowship of Nigeria, though a part of a block in CAN. We have Pentecostal Fellowship of Nigeria. We have other religious groups that can also take up this advocacy and talk to the ministers, and then the ministers will definitely pass it across to their members. Those are the different routes we can take to make sure that we get this to our members, most especially the rural areas. Most especially the rural areas. I think with this we can get to a lot of people. And the one you are doing as well. Yes, the one you are doing as well. The media too is part of it. With other medias. And when you meet, you can just decide and say, okay, for the next 1 week, let all radio stations talk about cholera. Prevention. It will get across to so many. It may not be all, but to so many. Okay. And we'll be able to achieve tangible results.
All right. Thank you so much. So finally, let's talk about vaccine.
Okay.
Is there any vaccine for cholera?
Yes, we have this oral cholera vaccine.
Okay, it's just oral?
Yes.
Okay.
It's oral cholera vaccine. And it was disbursed. There was a time we have this outbreak in Zamfara, and it was disbursed to them. And vaccine is not what you just bring out every time. You just bring it out once in a while to vaccinate the people, especially the children. So from cottage hospitals, especially in the East here, cottage hospitals, general hospitals, you can easily get those vaccines. Okay. It's not what you can just get anywhere, because preserving the vaccines are very expensive. Yeah. You understand? Yes. But you get them in general hospitals, cottage hospitals, government hospitals.
Okay, so it's just in the government hospitals?
Yes. Some private have it too,
okay, but
not all private.
Not everybody can actually
yes,
can afford these vaccines.
No, government gave them out free. Okay. The government will not charge you for vaccines. They don't charge for vaccines.
Okay.
But if you go to private hospitals, of course, they will charge.
So is there any medical outreach coming up anytime soon just for people, or is there anywhere there's usually a campaign? Because there's one I know about cancer. Every Saturday you go there for free cancer tests. Okay. Yeah. So is there any, does it happen too when it comes to cholera? Like people go there on a particular day and to get free vaccines?
I'm not aware of any for now.
Okay.
But I know that Nigeria, the Ministry of Health, have vaccines available.
Okay, so anybody who
understand?
wants any can
Yes,
go to any
if it's
federal
government,
government hospital.
state and government,
Okay.
you get it.
All right.
You get it. But you know, cholera is not like cancer. Cholera usually is an heartbreak.
Okay.
You know, we are able to contain it. Okay. But sometimes, maybe due to carelessness or something, the thing leaks out and it spreads very fast. And government also respond very fast. But cancer is what stays with people.
Yes, of course.
And cholera kills very fast. Cancer may not kill fast.
That will bring me to my last question. Does cholera have a cure? Or it's
cure.
just there?
No, it has cure.
Okay, there is a cure for it.
It's treated, and you'll be treated and you'll be free, you'll be okay.
Okay.
It has cure.
All right. Okay. All right, so that's our final question. Thank you so much, Dr. Taiwo Kolawole. It was nice having you in the studio.
Nice.
So cholera is fast, but knowledge is faster. So
Yes.
if you take the right steps, clean water, good hygiene, quick response to symptoms, we can save lives.
Yes.
Thank you all so much for being a part of this program today. Join us again, same time, same station, next week, Saturday, right here on Aneke TV. You can drop your comments across all our social media platforms on Facebook, X, Instagram, TikTok, and right here on YouTube, all at Aneke TV. My name is Amaka Nichi.
This is Aneke TV. We move with the world.